Welcome back to Sage Connections. If you've ever felt confused about nutrition, like one week carbs are bad, the next week fat is bad, and somehow everyone seems to thrive on something different, you're not alone. And that's exactly what we're unpacking today. Today's conversation is all about personalized nutrition and lifestyle through the lens of genetics, not as rigid rules, but as insight into how your body uniquely responds to food, stress, recovery, and inflammation. I'm joined by registered dietitian nutritionist Allie Babcock, who works with 3x4 Genetics, a company that looks at genetic pathways to help people better understand things like metabolism, inflammation, recovery, and long-term health. In this episode, we talk about how genetic testing for nutrition actually works, what it can and cannot tell you, and how this information can support everything from energy and hormone balance to chronic pain, recovery, and even postpartum healing. If you've ever wondered why there's no one-size-fits-all diet, or how genetics might offer clarity instead of more confusion, this conversation is for you. Enjoy. So for someone who's completely new to this space, what is genetic testing for nutrition and lifestyle? Why is it such a powerful tool for personalized health?
It's a great question. So I think when people think about genetic testing, they immediately go to either what we think of as maybe ancestry testing, 23andMe and the history of ancestry genetics, and then they go to, diagnostic of disease. So, you might be getting your genetics done when you're having a baby, or you might know someone with a genetic disease and they're going to a genetic counselor. When we think about nutrigenetics and a nutrigenetic test, it is neither of those things. So it sits in the middle. It is not diagnostic. We're not diagnosing you with a disease with a nutrigenetic test. We want to leave that really in the medical space and with those genetic counselors. And we're also not telling you anything about your ancestry or your family history or your lineage because that there's so much more to it when we think about targeting just genes and SNPs, single nucleotide polymorphisms or language changes in our DNA and how that makes us unique when we handle certain foods, nutrients, and the way that we live our lifestyle, how those things can affect it. So when you think about nutrigenetics and a nutrigenetic test, it's really a test that's going to tell you how to eat, live, and supplement for your unique genetics. And what I like about the company that I work with, 3x4 Genetics, when we look at a nutrigenetic test, there's a lot of noise out there. If you think about all of the genes that make you a human and make you uniquely you, there are so many that we have researched, and we don't necessarily know if they're all impactful. And if you have that kind of language change or that typo in your genetic code, if that makes an influence. And so the 3x4 genetics test actually has both what we call clinical utility and scientific validity built into the algorithm of its pathway design. What that means in really simple words is that you can do something about your genes and it's going to influence your biology. When you have a certain change in that language code, you can do something about it with nutrition and lifestyle.
Okay, so walk us through okay, let's say we want to do this. How do we, kind of take us through how 3x4 genetics works from collecting the sample to receiving the blueprint report?
That's great. So it's really simple. It's just a cheek swab, it's just saliva. So you buy your test, it comes in the mail, and you have a swab and a vial that you're going to basically deposit your sample in, which is your saliva. So you're going to take your swab, it's going to be like a long Q-tip. You're going to rub the inside of your cheek for a minute, and then you're going to put that into the vial with a little bit of liquid, and you're going to mail it off. And usually in about 3 to 4 weeks, your sample returns, and you're actually able to get your genetic information directly to an app or through working with a practitioner, such as myself or other nutrigenetics practitioners that have many different backgrounds. They can be physical therapists like you, they can be occupational therapists, nurse practitioners, doctors, dietitians, nutritionists, health coaches, all of them who are trained to be able to interpret this test can really give you information and insight about how to eat for your genes and how to make small lifestyle changes that are going to influence any symptoms you're having related to things that we can impact in your biology.
Okay. And so 3x4 kind of looks at genetic pathways rather than isolated genes, like you said. So why is that sort of system-based approach more useful when it comes to real life application and nutrition decisions?
That's a great question. So, remember when I was talking about the difference between the type of genetic test that is diagnosis based and you use with a genetic counselor versus a nutrigenetics test? So, when we look at something with a genetic counselor, one typo or one language chain in a gene there can make a big difference. It can usually have an outcome on you getting a disease or having a certain diagnosis. That is not the same in nutrigenetics. One typo language change doesn't have the same penetrance or same impact as the genetic testing that we're familiar with genetic counselors does. That being said, it's kind of like having a kink in your bike chain. If the system doesn't roll over well, something could rust, something could snap, something could break, and it's gonna, cause something to derail downstream. And so that's really what we're looking at. We're looking at addressing the patterns of the sum of its parts rather than just one individual SNP. And we're looking at how those patterns of genetics work together and how that influences the way your body functions, the way your biology functions upstream. And so I'll give you an example. If you have a bunch of language changes, a bunch of SNPs in your genetic code for all of the enzymes or the little proteins that help your body get rid of toxins, work through your liver, get rid of toxins, help you sweat out toxins, help you excrete them through your GI tract. If you have a lot of SNPs in that pathway, you might be somebody who gets a lot of migraines or has a lot of trouble breaking down alcohol. Might be somebody who increases your risk of having high inflammation, and that can trigger a lot of different symptoms and a lot of different diseases if you don't manage that well. So, a pathway-based polygenic analysis of your genes allows you to kind of put all of it together, look upstream, and figure out what the root cause of the problem is, and not pay too much attention to just one SNP, but really look at the whole picture. You're reading the story from, start to finish.
Okay. So, from a practical standpoint, I think some people might assume that genetic testing will tell them what diet to follow because there's so many things out there right now, paleo and carnivore and vegetarian and all this stuff. So, is that what this test kind of shows you, or is that a misconception?
I think it's a really great question because I think that's what people want. They want to be able to say that this is the diet that I need to be on. And the truth is, the diet that you need to be on is the diet that is best for your genes. And in many cases, I have worked with patients who say, come to me for weight loss. We put a strategy together based on, the best science. We do their genes. I refine that program for them. And then they come back a couple weeks later and they might say, my friend at the gym is doing keto. Do you think I should try that instead of what we've been put on? And I have to remind them and look back and say, in your unique genetic code, that's actually going to put you at risk because, for instance, you have a hard time processing fatty acids, or having too much saturated fat in your diet is actually going to potentially increase your risk of high cholesterol. So it's really important that you know the genetics because this kind of yo-yoing back and forth between all these different trendy diets for, say, weight loss or body composition recomposition is putting people at risk for their long-term health. And the diet that you need to be on for your genes is a diet that you're going to be able to sustain and is going to give you the best support for your health and your goals overall throughout your lifetime.
Is there any correlation with kind of I mean, I know we talked about how the ancestry genetic testing is slightly different than this, but is there a component, like, let's say, I'm Russian and, my ancestors ate, I don't know, beets and whatever, does that play into it? Kind of like what your ancestors ate based on the geographical area where they kind of mostly lived?
Yeah, I think It'd be an interesting thing to, research to see if that has a lot of correlation. But I would say that what we see is it's very similar to, if you fill out a family history, medical history in a doctor's office, when you think of, oh, my entire family has issues with their heart. They have heart health problems. Somebody died of a heart attack, or they had a bypass, somebody died of a stroke. That to me reads that genetically in your family line, you have a lot of potential issues that we want to look into around how you handle lipids, so your cardiovascular and your cholesterol health, potentially the health of your vascular tissue, so the pipes that pump the blood around your body, that has a component of it. And so there's things to look at from that standpoint. Overall inflammation plays a big role in this. And so I feel like that has probably more of what you see come up than necessarily what you need to be eating. But there are uniquenesses that I find people like, or foods that they enjoy in certain cultures that come up. For instance, if you do have issues with your vascular health, we want to be able to dilate those blood vessels and make those pipes as wide as possible for the blood to flow through and get all that powerful oxygen and anti-inflammatory action to your muscles and your tissues. Perhaps those people are not really great at utilizing nitrates. And so it might be that beets, like a borscht, if you're from a Russian area, or leafy greens like spinach or collard greens, are something that's part of your culture and part of, the makeup of your food history and your cultural food story. And that can be something that you see as a trend overall. It's almost like a balance. How these foods for a long time have come and have benefit. Their superfoods don't have to be fancy from all these different places in the globe. There are superfoods in all of our cultures that play a role in the ability to talk to our genetics and make it so that you can actually work with what you have, and that your family history doesn't have to be the fate that you live, right? You can modify things along the way.
Fascinating. So it's almost like maybe part of it's cultural, but a bigger part of it is your own specific makeup based on your family genetics. Because we're all at this point, I mean, it's a melting pot. I'm Russian, but I'm also Jewish, and people are Irish and German and this and that. So yeah, that's fascinating. So
Like,
when
I
you're
like to say I have the Irish potato famine genes because I like to hold on to my energy for like a rainy day. And that works with my heritage, but it also works with my genetics. So it's kind of interesting. Those things may or may not have been linked in one point in time.
So if that's the case, then so let's talk about like a real life example,
Mhm.
like yourself. So if that is what the test kind of tells you, does that mean you kind of stay away from starches, or does that mean you lean into starches?
Yeah, so when I say, well, I call it the Irish potato famine gene, but really what it means is it's called a thrifty phenotype. So it's somebody who, in a time of famine, I'm really good at storing and liberating energy. So it actually has more to do with my fat stores than anything. But in an environment that we are now, where our environment is more what we call obesogenic, there's lots of really great, tasty, delicious food around. It's, we sit for a majority of our days. I'm not working the fields anymore. We're thinking about how my genetics and kind of that story of me would play out in that modern environment. And it can be that I have more of an issue with managing weight. And so there are certain things you can do to help liberate your fat stores. One is lowering inflammation. Another might be fasting for an extended period of time. And so those are little small tips that your practitioner would basically look at and say, based on everything you're going with your genetics, this might be what you need to do for, say, weight management or weight loss. And that's just one example of one pattern or one gene that influences an overall story if when you're looking at it in concert. And so that's kind of an interesting way that, family history, but also genetics plays out in a modern environment.
So let's talk about inflammation,
Mhm.
and then maybe we can dive a little bit into how that affects other things like fertility, for example, or pregnancy and things like that, where, that kind of speaks to my population of patients. But inflammation shows up in a lot of ways, right? We have chronic pain, we have hormone imbalance, gut dysfunction, pelvic floor symptoms. So how can genetics help us understand someone's inflammatory tendencies and recovery capacity?
That's a great question. Inflammation is probably one of what I would say is four stools of how I would look at cellular health. So I would look at inflammation, the way your body handles fire and how it brings the army to fight illness and heal you. And so how much fire does it bring? I also look at oxidative stress. How prone is your body to rusting? I look at how your body breaks down toxins and gunk, whether that's gunk from exercise, gunk from the environment, like plastics in the air or smoke or smog, and and also things that we eat, so processed food, alcohol, things like that. And then finally, we look at methylation, which is basically how good is your body at creating the building blocks it needs to turn genes on and off and regulate all of those systems. And so all of them work together. So when I think about inflammation at a genetic level, inflammation can be showing up, but any one of those stools or all of them can be a little wobbly or need a little adjustment. And so it doesn't have to be just the stool of inflammation or the leg of inflammation. It could be any of the things that are actually influencing that at a genetic level. When we think about targeting in on how inflammation plays out in the body, that fire that's everywhere, I think about it as a way of toning down your body's response to inflammation because most of us are over-inflamed. We're over-responding to our environment. I think about having really high symptoms of allergies and histamine. So maybe you're having a lot of hot flashes if you're going through, various changes in fertility, menopause, postpartum. There's a lot of hormones that get released during that phase. And so you might have trouble breaking those down, and you might be adding gasoline to the fire with a lot of histamine in the environment. And so inflammation can be the symptom that you have, that flushing feeling, but it actually might be something else that you're having an issue with. So when I think about the way that genetics can help us get to the root cause of these issues, you're looking at it at a cellular level and you're able to get really specific about what might actually be causing your problem that is showing up in another way for you. Muscle issues, soreness, hot flashes, pelvic floor dysfunction. It might have a different upstream approach and we might not be treating it properly. So that's why I think genetics is so important to do because it allows you to get really laser focused on what you need to do next and how you need to address the next phase.
Yeah, this feels like almost the missing piece, right? I mean, especially when we talk about chronic pain, and sort of chronic symptoms, it's really difficult to pinpoint where it really comes from because usually people that have been suffering for years, they've seen all the practitioners. They've seen functional medicine doctors and PTs and acupuncturists, and they try the fad diets, that are supposed to decrease inflammation. But I suppose that if you don't know what decreases inflammation in your own body,
Mhm.
then you might actually be doing something counterproductive to your own sort of your health.
I think it's probably more that so many, and I very much agree. It is the missing link or addressing, getting insight into what is there. I think so many people find temporary relief with all of these different practitioners and all these different solutions. It's kind of like putting Vaseline on chapped lips, right? You're not actually addressing, the windburn or your dehydration or the thing that caused your lips to chap in the first place. You're just putting a Band-Aid on the solution. And so for many people, that is an important way to get relief when you think about something like chronic pain. It's important to be doing those strategies as long as you're addressing the root cause problem to get to the end of symptom relief in the end. And for many people, these things are maybe not something they can find total resolution of, but they can make their symptoms so much more manageable and better. And people who live with chronic pain or any kind of chronic autoimmune disease will acknowledge that when they did these kind of concert of things, whether that was a diet strategy, a stress management strategy, and a physical movement strategy, those kind of combinations of strategies together got them resolution of their symptoms or lessening of them. And so genetics is a great way to just get to what those might be for you faster.
Wow. So can you touch a little bit more on fertility? We were talking a little bit offline about this.
Yeah.
If a couple is getting ready to have children and maybe they're having a hard time, how can this help?
I think that couples who are doing any kind of preconception planning should 100% get a genetic test. Both couples should. Nutrigenetics is a really great way to start from a lifestyle standpoint because you can really tone and or hone in and address supplement imbalances and get a better diet strategy to really lower inflammation and support fertility overall. When I think about fertility for women, there's obviously I think things that people are well familiar with and are and have become very popular in culture now or a little more mainstream is thinking and talking about like MTHFR as a gene and a SNP. But that is just one gene that deals with one component of the way that your body uses folate. And there are so many more um, proteins along that system and SNPs in that genetic cascade, in that system biology cascade, that influence your body's ability to make methyl groups, which is ultimately what is the end issue with methylate with fertility. It's can you make new DNA and can you turn the genes that need to come on at the right time so that you can grow a healthy baby. And so that's just one pathway and one example of that comes from both partners that has an influence on fertility. And so getting something like that honed in from a much bigger systematic view is really important. But then there's also components about how your body handles hormones and how you're going to feel during your pregnancy or what contribution your partner and their genetics is going to have to say like the health of your placenta and your symptoms during pregnancy. And so all of this, the science supports has an influence. And so preconception planning and supporting with a genetic test is a really great strategy. And I think very much worth your investment, especially as you enter kind of the first time you've been pregnant.
Okay, fascinating. And then sort of on the other end, not on the other end, but like in the later stages of life, how can this help support perimenopause?
I love a genetic test for the reason that you take one test in your whole life and it applies throughout your lifespan, right? Because your genes don't change. You can do your genes at 6 months old, or you can do your genes at 99, and they're going to be the same genes you were born with. So the same pathways, hormone pathways, thinking about your detoxification ability, thinking about the way that you break down oxidative damage in your body and how you support your body's ability to handle changes in estrogen is going to be as impactful when you're going through pregnancy, when you're in your postpartum period, as it is throughout all of your years menstruating and perimenopause. And if you think about if you're somebody who suffers from, really severe PMS symptoms or you have really wild hormone swings, you might have an underlying cause with detoxification or hormone balance in your genetics that is actually a pretty easy fix to take a small dose supplement or eat a few powerful foods. I love broccoli sprouts. They have a huge ability for your body to activate a compound called sulforaphane, which helps you detoxify and upregulate some really powerful transcription factors that are like massive energy. They're like bringing everyone to attention on your genes and upregulating them. And those small tips can actually help you, manage your PMS. It could help you manage your perimenopause symptoms so much better because the thing that you're suffering with is the, fluctuation in your hormones and the way that your body is feeling and reeling as a result of that hormone fluctuation. And so helping your body to break down all that extra energy or those extra hormones is actually what's going to make you feel a lot better.
Okay. And then I know you work with some professional athletes and teams and things like that. How does knowing your genetics affect, on that level, which they're kind of like looking for at the smallest edge that they can get, right?
100%. Yeah.
Um, how does it help with recovery? How does it help with optimizing performance? Um, any thoughts on that?
No, it's a for me, it's an absolute necessity in the elite performance space. If you are somebody who is fighting for that 1% edge, what is going to give you a 1% edge when you are working out every day, you have back-to-back games or very close games, and you're trying to perform at your best level night after night? You need something that's going to be able to help you hone in on your routine. And I think the other thing in professional sports is that it's all about the minimum effective dose. So, what's the smallest amount of a supplement I can take, a time I can spend in the sauna, time I can spend in a cold plunge, amount of massage that I need to get in order to maximize my performance and my recovery. And a genetic story is going to help you hone in on those facts. It's going to tell you that this habit stack is what you need to be performing at your best. And I love working with the 3x4 team because they actually have a product, and the amazing science team has put together a product called GeneFit, which actually tells us more specifically about your recovery genes, your injury, or your recovery pathways, your injury pathways, and the pathways that are going to be important for you to train towards for enhancing your power, your VO2 max, and your endurance. So there's a whole level of genetic science that can be applied to athletics, professional athletics. And I feel like we're just at the tip of the iceberg in elite sports in seeing this come mainstream. It won't be long. It'll be 5 years, maybe max, before this is going to be so much more mainstream, and so many more people will have done a genetics test in a performance environment and will have their training plans based on that.
Well, and speaking on that, so looking ahead, how do you see personalized genetics evolving in health and wellness over the next, let's say, five to 10 years?
Yeah. Well, I might be biased, and I think everyone should know their genes and use that for their genetics, but and their ability to, take control of their health. But what I've seen in health and culture in the last 5 years has been that really the driver of direct-to-consumer care and personalized wellness has become up to the forefront. People are no longer waiting for information, they're seeking it themselves. And you're going to see the introduction of AI and the ability to have see experts become more accessible to more people. So having the power of your own genetics and knowing how to access those experts through technologies like AI and through more mainstream, expert-driven content such as podcasts and, sessions like the ones you're putting on here are going to give people the ability to access information that they haven't before. So having genetics be part of a conversation, I think it's going to be that the drivers of genetics into healthcare are going to come from the patients first and foremost, pushing it into a more traditional healthcare message than necessarily traditional healthcare adopting genetics, particularly nutrigenomics in its practice mainstream. I think it's going to be very much a top-down approach that we see people coming to their doctors and saying, these are my genes. How are you going to change my medication routine? Or this is what I'm working with. How are you going to use that for my weight loss management program? And it's going to force practitioners to, learn up quickly and understand how to, meet the needs of their clients.
Yeah, I mean, I think that's been the trend overall in the last, I don't know, 5 years or so, where people are looking for wellness and longevity and support versus going to the doctor because they're sick or because they, broke something. They're looking for prevention, and it does kind of come from this grassroots, uh, sort of place versus from, I mean, there is a place for surgeons and medical doctors that go through our sort of allopathic system for sure. But I think sometimes Western medicine is more focused on healing like a sickness versus overall well-being and preventing,
Mhm.
things from happening to begin with. And
Yeah.
so, yeah, so this is right in line with where I think everything is going. I think the healthcare system, the landscape will change so much once more people adopt this mentality of, you know, prevention versus, I never go to the doctor, I don't care about my health. And then you end up in a situation where you have cancer, or you have heart disease and things like that. So brilliant. I'm so excited
Yeah.
to learn about this. Thank you so much for coming. Any last words to the audience?
No, I so appreciate you allowing me to speak about this a little bit more. I mean, I think if there was any takeaways, it's that, you know, don't wait to know how to eat, live, and optimize your health with your genetic information. It is yours. You deserve to know what it is, and you deserve to have the best solutions tailored to you. The time for personalized medicine is now, and the time for personalized performance is now. And I couldn't encourage people anymore, seek this if you're able and work with experts who are able to really hone strategies and that are going to be so tailored to you and the individual story that you tell.
Perfect. Thank you so much. Thank you so much to Allie Babcock for joining me today and for sharing her insight on personalized nutrition and genetics. I really love this conversation because it reframes genetics not as rigid rules, but as a tool for understanding how our bodies uniquely respond to food, recovery, and inflammation. And as always, thank you to everyone for tuning in to Sage Connections. If you enjoyed today's episode, please subscribe, share it with a friend, and leave a review. It truly helps us grow this community. Until next time, take care of your health and your wellness.